When you're working with couples, how do you balance off talking about some of the things that are in someone's past and balancing the future solution,
Yeah.
especially with somebody who's really caught up in that, you know, they don't want to talk about it kind of thing?
hmm Well, I think if somebody doesn't want to talk about it, I mean, obviously that is their prerogative. I might gently, I guess, open the viewfinder is how I often think about it. Because again, people often come in very, this is the problem.
Mhm.
This is the problem with my partner. And I want to like open this viewfinder to contextualize it, to help people see how there's a different way of looking at it that is more likely to lead to solution, and
Mhm.
that blame will only keep them stuck and create a bigger and bigger wedge. I often see when we frame it in this different way that people open and soften to that. And there are sometimes small pieces of individual work, particularly using my one of my approaches in individual therapy called internal family systems. And I've done some training in internal family systems specifically for couples where we might do a brief piece of work. I might be working with an individual on, let's say, their father abandoned them at a young age, and now they're terrified that their partner is going to leave them. And with the other person being able to not have to be part of that conversation, but kind of be an observer, it's like they're able to see this pattern in a way that they couldn't when their partner is directing that at them.
Mhm.
And I might do a brief piece of IFS work with the one. And then again, that's the helping them to be their primary caretaker of that little child in them that is, in that case, afraid of abandonment. Um, and then we may bring the other partner in to see how they can be that secondary caretaker and how the type of conversation between them about this issue changes with this understanding of how it isn't just about the partner, but it's about a person's past. Occasionally, if the trauma is particularly significant, I may do a little bit of individual work with that person if it is right for all three of us to be doing that, so that we can get a little more traction. But I do think there's something powerful about somebody witnessing their partner's individual work in the couple's dynamic.
Yeah.
Creates a lot of empathy and understanding often.
It's what have previous clients said about working with you that you think is a unique piece of that you bring to the
Mhm.
team?
Well, I've heard a lot from people that, they, of course, that feels like a safe and warm place. But I think that I also challenge them at their comfort edge, to learn and grow. Of course, I want my therapy room to be a place of acceptance and safety and comfort. But also, I feel my responsibility as a psychologist is to help you heal, to help you change, to help you understand not just that you're stuck, but why you're stuck, and then how to heal why you're stuck so that you can move forward. And that in the moving forward, we're also then looking in that more practical, skill-based way of how to show up differently with yourself and in the relationships in your life.
And what's some of the feedback you've received when you've approached it that way?
Well, I have seen many times people say to me, I've seen three therapists and nobody brought this up.
Mm.
Or this is the first time I really understand and I'm able to relate differently to why this thing is hard for me, whatever this thing might be. And they are able to take that out into the world when I'm not there. It's sometimes I hear people say to me, I heard your voice in my head when I got triggered and I did something different. And that's, of course, that's so gratifying to
Yeah.
me that they are able to take the work that we are doing and apply it in real life because, all the insight in the world isn't going to help you show up differently in your life unless you can translate that insight into the pragmatic work of healing and changing.
Mm. Um, let's we're going to talk about something you already spoke about,
Hmm.
but I wanted to talk about ineffective approaches. There are a lot of ineffective approaches that I've seen that have not worked for people.
There's a lot of different ways to do therapy. People have been trained in a wide variety of modalities. And I think there are just some therapies that aren't as effective at creating change as others. I think most therapy approaches, create empathy and compassion and a safe space. And that is, of course, the foundation of effective therapy, because if you don't feel safe in the therapy room, nothing is going to happen. But I do think that some therapy approaches kind of stop at that, or have sort of offer approaches to feeling better that strike me as a little bit superficial.
Mm.
And I am trained and deeply believe in and have experienced in my own personal therapy work a much deeper approach to healing that is about understanding all of the wounding and trauma from our past, as well as the things that we just didn't learn about how to handle ourselves and handle relationships. And so this approach that for me combines that deeper work of the trauma and the wounding of uncovering it and actually healing it, because just knowing that you were wounded isn't enough.
Mm-hmm.
And you can't just say, it was a long time ago, I forgive them. And not to say that that isn't a bad thing. Of course it is. But I think some people jump over all the work because they just want to get past it, as opposed to what does it actually mean to heal that work versus just put it in the past.
Mm-hmm.
I think sometimes it's dismissive of our young childhood experiences to just say it was in the past, it was a long time ago. But I do think we can get to that place with some of that deeper work to say it truly is in the past, where it really isn't impacting me anymore, or the ways that it is impacting me, I know how to manage. I know
Mm.
how to work with them. So when they come up, I don't go down as deep. I don't stay as long, and it doesn't impact how I interact with other people. And that makes the more pragmatic therapies, cognitive behavioral therapy, learning the skills of communication, that's where they can really get traction because they're on solid ground. And so we can use these more pragmatic approaches in a way that is not just a Band-Aid, And I think that they dovetail and fit together really beautifully to create sustained, lifelong change where you are becoming more of who you are, not less.
What are your final thoughts on couples that are considering seeking counseling?
I know that everybody is nervous to go into couple therapy. I have been nervous when I have gone into my own couple therapy because it's vulnerable. You don't exactly know what's going to come up. It's sometimes hard to hear the mistakes that you have made. We all make mistakes. Sometimes we even make a mistake. We think we are doing the ideal thing and it doesn't land with our partner, or there's something beneath it that we just weren't aware of. It's okay. We are imperfect beings. The goal is not to be perfect. And when we can embrace that and just be willing to understand ourselves and understand our partner, it is so possible to create something far beyond what you think is possible. And it can be such a growing, bonding, healing experience where we're healing ourselves, we're helping our partner heal, we're growing together in this way that is just so profoundly gratifying. I think,
What?
I would also want to add, in terms of people who are considering counseling, come earlier rather than later. Even if you're just a relatively new couple and you're starting to see the bumps in the road come up, or you're really happy and you want to make sure you can keep it that way, I think that even just a brief experience of couple therapy can make it better. And the sooner you intervene, the better. even if things are already getting challenging.